Well, welcome back. Our next guest is a doctor in the know. Dr. Tif Siragusa treats a multitude of vein issues, and today we are going to talk about painful and enlarged varicose veins.
They exist. Many wonder if they're actually covered by insurance, though. Dr. Siragusa, he deals with all kinds of questions like these. So let's start with kind of the misconceptions when it comes to insurance and vein treatment.
Sure. So we see a lot of patients that come in with pretty advanced vein disease. So large veins, and vein disease also leads to skin problems like itchy skin and ulcers. And the most common reason they've put their treatments off until it's gotten so bad is because of the misconception that this was only a cosmetic problem and that it would be super expensive and the procedures take very long to do and a lot of recovery. Most of these people were so shocked to hear that insurance does cover several vein procedures, especially when it gets to an symptomatic state.
Wow.
Yeah.
Is there a way to tell when looking at your veins if they are cosmetic or there's a bigger issue?
So pretty much all vein disease has that cosmetic component because nobody loves the way varicose veins look. But once they become symptomatic in that your leg starts to swell, you start having difficulty getting through a day at work because you've got pain in your leg, you've got itchy skin that keeps you up at night, restless legs, painful ulcers, then it crosses over also into the medical side where the insurance does come in and pick up treatments.
Okay, awesome. I actually want to know about the process of clearing out these veins. It almost seems magical, which you do have this cool gun at your office that kind of tracks where the vein is.
Laser.
The laser, how exactly does it work? Tell us your secrets.
Yeah, so veins are meant to bring blood up back to your heart, out from your legs, okay? And there are little one-way valves inside the veins that promote the blood flowing upwards, and then they're like check valves, so they close to prevent it from coming back down. When those valves fail and turn into basically swinging doors, now blood that's in the vein ends up coming back down into the leg and pooling up and stretching out all the veins below it. So what we do is we get an ultrasound to find the source of the problem, what we call the feeder vein. And once we identify the vein that's leading into all of these varicose vein clusters, we're able to go inside of it with a laser, inject some local anesthesia, seal it off from the inside, and that basically closes this trap door and no longer allows all this old blood to just fall back into the leg and cause all the problems it does.
Wow, I think we have some before and after photos. If we could take a look at some of the here, wow, that's very dramatic. If someone has a vein issue like this, do you advise they just come in and get advice from you? How do you figure out if your insurance covers it, if it's a serious issue?
So what we do is we offer several options for people. This time of year is very busy for a lot of people. So we do offer free FaceTime consultations. A lot of people they just want information. They're in that stage where they don't know what their options are and they don't really want to book an appointment and take a half a day to do all that. So we offer free consultations with FaceTime where we can answer a lot of questions. And then also if they're at the point where they know they want to move forward and get something done, we do a consultation and an ultrasound the same day, which saves them a lot of time. By the end of that visit, we can tell them exactly what's going on, what it would take to fix it, and give them an estimate of what their insurance would or wouldn't cover.
Well, and I want to talk more about that. So let's say someone doesn't know if their insurance covers it. Your office actually works with people step by step.
Right. So we take all Medicare, Medicaid. We take almost 95% of the commercial insurances. And most of them are very similar in that once you do start having problems that affect your ability just to carry out your normal activities, then they will cover your treatments. And we will submit your history, your photos, your ultrasound reports to your insurance along with what's going on and how it's affecting you. And once they get back to us, which can take a couple weeks, we then give you a call and let you know, okay, they approved this, they didn't approve that, and kind of work with people on that.
Okay. All right, you guys do more than just veins, I believe, right?
Yeah.
What else do you all offer service-wise?
Yeah, so when it comes to the veins, we do leg veins, but we also do facial veins, like spider veins on the nose and cheek, and bulging forehead veins and temple veins. And then we also have a med spa, so we do Botox, filler, and a lot of laser procedures that keep that skin looking glowy and young.
I have seen you before. Now I have a question about varicose veins. What causes this?
Yeah, so the majority of people who have symptomatic varicose veins have a family history, so it's a very, very genetic. Also occupation, people who are in occupations where they have to sit for prolonged periods of time, stand for prolonged periods, are at higher risk. And once a woman becomes pregnant, the hormonal changes that occur with pregnancy. If you are predisposed to varicose veins, that sometimes pushes you over the edge, and kind of that's when you start to develop them.
You have a long time reputation here. People fly in from all over to come see you, don't they?
Yeah. We have quite a network of patients that come in from all over. We had a guy flying from LA 2 weeks ago. Wow. Yeah.
Anybody famous?
I can't say.
Right, patient. It's called HIPAA, people.
Nice try.
Best part is you're in and out.
Right.
Please explain.
Right, yeah. So most of the procedures that we do for the leg veins, whenever anyone asks, how long is this going to take? I tell them, I don't know. We're going to listen to 2 or 3 songs and then we'll be done. So 7 to 8 minutes usually is what it takes. And a lot of times, I'll say 1 out of 5 times when we're done, the patients are like, I thought you just started. They can't believe how fast and easy it was. Yeah.
So nice.
Awesome.
We will take it. Thank you so much,
Thank you,
doctor.
guys.
Good to see
Thank you. You as well.
All right, everyone. This QR code right there on your screen, it'll take you to their website. You can make an appointment and find out everything that they have to offer. Visit NashvilleVeinCenter.net.